It's unfortunately very easy to summarize the current situation in the pandemic right now because it's by far the worst that it has been since the pandemic began. Every aspect, every metric is the worst since the COVID-19 pandemic began. And we have utterly and completely failed to contain this virus. We have failed to contain this pandemic. And it's despite knowing ways to effectively contain it, we have failed. And I think that's what's so heartbreaking and so frustrating about this. We know that masking and distancing and avoiding unnecessary gathering, we know these things are effective. We have seen examples of other communities and other areas do this, and we are failing. And a large driver of that failure lies with state leadership and a lack of a mask mandate and a lack of clear communication about how this is so crucial. Cases are absolutely surging, as Dr. Martin mentioned. We're either first or second almost every day this past week in weekly new cases. Hospitalizations are surging. Hospitals are full, they're overflowing, and hundreds of Tennesseans are dying every day. It's a natural disaster every day, and we're opting into it every day. We're opting into a new natural disaster where hundreds of Tennesseans are dying. We know what to do about it, and we aren't, and it's frustrating. And I think that my heart goes out to my colleagues on the front lines, my critical care, emergency department, hospital medicine colleagues who are doing this every day, and they're all fantastic, but they're outmatched and they're outnumbered. And when a hospital is overwhelmed, it's an issue that trickles down to all issues, not just COVID-19. An analogy I'm fond of is a sports analogy. This is a big football state. You can take 2 or 3 of the best defenders in the history of football and you put 2 of them on the field. How are they going to do? It's a losing battle. You're outmatched, you're outnumbered. It doesn't matter what your skill is. And so we're allowing that to happen. The vaccine data that we have, the vaccine news is incredibly hopeful. It is clearly our path forward, our path out of this, but it's still in the distance. It's going to be weeks to months before that effect is seen on the level of hospitalizations and new cases across the general population. And we have to act in the meantime because hospitals can't remain overwhelmed or there are not going to be enough people to receive the vaccine because we're going to have too many unnecessary deaths. So one of the challenges, it's all really complicated and it's all moving very fast and there's really no protocols for any of this, right? Everybody's figuring it out in real time. One of the really difficult things about the Pfizer vaccine is that its requirement for extreme cold storage and the handling is really crucial. And the shipments come in doses of 975 and they can't really be divided up easily and allocated. And so there are a lot of healthcare facilities, for example, that have employees who desperately deserve as much as any employee of any other healthcare center to get vaccinated in that first wave. But if it's a small institution with fewer than 975 doses that gets that shipment, then there may be some that go to waste. And so it gets into a really complicated discussion of resource allocation. That is not my particular expertise, and I don't know all the details that went around the decision from that single initial 975 dose shipment. I do know that as the others are arriving essentially today into tomorrow, and they're going to be widespread allocated throughout the state to medical centers that are large enough to accommodate those 975 dose shipments. Hopefully, as we learn more about how the vaccine can be stored and handled, and as other vaccines hopefully soon come onto market that have a little bit less stringent cold storage requirements, we will be able to blanket the healthcare workforce that they need. So I think it's really tough. I don't have the sense that anybody thinks that a healthcare worker at one facility deserves it any more or less than another. These are frontline providers. It's crucial that we figure out how to get that allocated. And there certainly seems to be no indication for holding on to these or stockpiling anything for a future time where it's needed. The doses are needed now. And hopefully those logistics can be worked out really soon. I think people listen to their elected leaders, and I think the voice of leadership holds a lot of weight. And what a mask mandate would do is not just to hopefully enforce the mask, but also send that message of how crucial and how important this is and what a dire situation we're in. And so I think other messaging along those lines to this, the data that we've talked about today, the information, I think what I crave from our leadership would be a statement to say, we are in a dire situation. Tennessee is one of, if not the worst state in the nation right now for COVID cases. That needs to be owned and it needs to be addressed because it's true. It's the situation. This is a natural disaster every day. And so we need to take this seriously. I haven't heard enough urgency. I haven't heard enough desperation from our leadership to say, well, this is a crisis and we need every person in this state to play ball and to do what these things that are effective that we've talked about. So I think the messaging is probably just as important, but I think what a mask mandate would do would also be to send that message in sort of an action speak louder than words type of way.